Today we'll be discussing on what is IUI. IUI is a simple outdoor procedure. It is called as intrauterine insemination. What we do in IUI is we take the husband's sperm, we separate the best quality of the sperms, discard the seminal plasma, the dead sperms and the cellular debris, and the highly concentrated motile sperms are selected and they are injected directly into the uterus along the peri-ovulatory or the ovulatory period. The intention of IUI is to harvest the best quality of the sperms and inseminate as close to the fertilizable egg. Here you bypass the vaginal acidity, you bypass the cervical mucus, and you directly inseminate highly motile sperms into the endometrial cavity. So the distance the sperm has to travel is shortened, and when the egg is ovulated, it comes into the mid portion of the fallopian tube, and large number of sperms are available for fertilization, and the egg fertilizes and eventually leads to pregnancy. So this is called as intrauterine insemination. Now, what are the prerequisites before intrauterine insemination? Now, there are some prerequisites for the female and prerequisites for the male. For the female is stimulated with either ovulation induction drugs like clomiphene or letrozole, and in some cases, some gonadotropins are added to produce 2 or 3 extra follicles. Now, the female is serially monitored by ultrasound, and when the leading follicle reaches 18 mm, HCG injection is given for ovulation. So when you give HCG injection, it has to be timed in such a way that IUI has to be done 34 to 36 hours after the HCG injection. Now these are the monitoring points for the female. For the male, the things are they should have abstinence for 2 to 5 days before giving the sample. They should collect the sample at the clinic preferably. The sample should be collected properly, ensuring there is no spillover of the sample outside the container, and full aseptic precautions need to be followed. When the sample is processed, then it is left for liquefaction for 30 minutes. After liquefaction, the semen is analyzed, the count is assessed, the motility is assessed, and the morphology is assessed. Now the samples prepared for IUI, they can be prepared by 2 methods. One is swim-up method and one is density gradient. If the sperm count is normal with good motility and good morphology, simple layering by swim-up method is usually recommended. In swim-up method, you take the raw semen sample in a 5 ml tube, take 1 ml of semen and layer with 1 ml of culture media, and you keep this for incubation at 37 degrees in 6% CO2 for 40 minutes. What happens? The highly motile sperms will migrate towards the upper layer of the test tube, and you can aspirate those healthy sperms, and those sperms can be used for IUI. The other common method used for semen preparation is density gradient. You can have different forms of density gradient. It can be 40, 80, 60, 40, 90, 10, different density gradients. If the male partner is having a count between 10 and 20 million or with decreased motility, in these patients the density gradient method is advised. In density gradient method, the lower density is below, upper that is the upper density, and the top of it is layered with 1 ml of semen. Then it is centrifuged for 15 minutes at 1000 rpm, and the supernatant is discarded, and the remaining pellet which is left, it is laid by normal media, and the sperms which swim up after that, those sperms are selected for IUI. After IUI, it is advisable for the patient to take rest for half an hour, and after that patient can do her regular activities. She is advised to do her regular household activities and office activities. The advantages of IUI, it is a daycare procedure. There are no hard specific precautions to be taken. Whatever general care and precautions are to be taken, they are advised accordingly. But unfortunately, the success rate with IUI is not that great. Overall success rate with IUI is about 10 to 15%. So if you do 100 patients in a month for IUI, you won't get a success rate of more than 15%. Means nearly 85% of the patients don't conceive. So for this group of patients, we advise to do IUI in the subsequent cycle. If the patient age is less than 30 years, we advise minimum 3 cycles of IUI. If he doesn't conceive within 3 cycles of IUI, depending upon the indication, depending upon the age, and depending upon the semen quality, the patient is advised 3 more cycles of IUI, or the patient can directly go for IVF. But if the patient is more than 34 years, it is not advisable for the patient to go for more than 3 IUI cycles. If she doesn't conceive in 3 cycles, it is best, don't waste time, don't waste her egg count. It is advisable the patient should go for IVF.